In the fight against Covid-19, researchers need to know where it is and how it's spreading.
What we're trying to do is to improve the understanding of how the Covid-19 pandemic is progressing across England.
Around the world, researchers are starting community transmission studies to try and gather enough data to inform public health policies. But to get enough data, they need to find a way of testing people at home.
Don't eat or swallow any part of the kit.
People like me.
Got it. I'm Anna, and today I'm going to be doing an antibody test for Covid-19.
I'm one of the first guinea pigs for a home antibody test being trialled here in the UK.
So I'm involved in a study called REACT, and REACT stands for Real-Time Assessment of Community Transmission.
Christina Atchison at Imperial College London is part of the team behind the study. Before rolling out a full-scale community transmission study, they need to first figure out whether kits like these are accurate and usable. To test for accuracy, the team are comparing self-administered results with proper blood tests in a lab. To test for usability, they've posted home test kits to 10,000 randomly selected people, including me.
So what we're really trying to understand here in the usability study is firstly whether people can perform the test at home.
Come off. Okay.
And if not, what changes we can make to the test or instructions to improve people's ability to carry out the test at home.
Oh no, it's just going back up. I've sprayed blood everywhere. Oh no. Okay, got it in.
And secondly, can people read and interpret the test results? And if not, what changes can we make to the wording and messaging to improve people's ability to understand what the result means for them?
Antibody tests like this aren't designed to tell me if I currently have Covid-19, but could tell me if I've been infected before. In this case, by testing for a type of antibody called IgG.
So really what we're most interested in is IgG as a marker, as a potential marker for long-term immunity. Certainly in other infections, it is a marker of long-term immunity, but as yet we don't know if it is for COVID-19.
Immunologists are still working to find out whether having had the novel coronavirus and having IgG antibodies in your blood will in fact protect you from catching it again in the future. Until then, my results aren't very much use to me personally. I'll still be observing social distancing like everyone else. But for Christina and her team, my data can help get the home antibody testing kits in top shape for the next round of tests.
Once we've optimised usability for home testing, then we plan to roll out the test to 100,000 randomly selected people across England to assess the prevalence of past infection in the community.
In the meantime, there's a lot of work to do.
I've worked a lot of weekends over the last 2 or 3 months. Things are changing all the time. Every other day in the news you hear about another test, be it a new swab test or a game-changing antibody test. People are very desperate and keen to know when we're going to get back to some level of normality. So with that in mind, we're sort of happy to be working sort of twice as hard.